The urogenital tract is an interesting area of the body to talk about because unlike other parts of the body that we've already discussed, like the GI tract, the respiratory tract, the mouth, where the majority of the people have all of the same parts, the urogenital tract, there are two major types of urogenital tracts, and about 50% of the population has one version, and 50% of the population has the other version. And those two versions of the urogenital tract can really dramatically alter what microbes are present in the urogenital tract and can dramatically alter a person's propensity for having infection or disease. So altered conditions in the urogenital tract can allow pathogens to get into the urethra, pathogens like E. coli or Proteus, and when those pathogens get into the urethra, they cause disease. We call the first form of that infection a urinary tract infection. That can be characterized mostly by pain during urination, but if left untreated, those microbes can move their way up the urogenital tract into the bladder. That can cause a bladder infection, and then it can go all the way up into the kidneys. And so an untreated urinary tract infection can be very dangerous for some of our patients. So again, E. coli and Proteus frequently cause urinary tract infections in people who have a vagina. And so that question may be, well, why? Why does having internal versus external genitalia predispose 50% of the population to a urinary tract infection? Well, if you know anything about the anatomy of those areas, if we're talking about the vagina, right next to the vagina is the opening for the urethra. But in people who have that anatomical organization, the anus is much closer to the urethra than in people who have a penis. With the penis, the urethra opens up at the end of the penis, and the distance between the opening of the urethra and the anus is pretty significant. So the majority of patients who turn up with a urinary tract infection are people whose urethra is close to the anus, and it's often because of a little bit of improper hygiene. We're basically talking about the idea that fecal bacterium have gotten into the urethra. The closer the urethra is to the source of the fecal bacterium, the more likely that those fecal bacterium will get into the urethra. So we see that here. The urethra is much closer to the anus, whereas when the urethra opens up at the tip of the penis, it's much farther away. So it's harder for people to get fecal bacterium into the tip of the penis, whereas when the urethra is really close, it's just much more likely. Now, the urinary tract itself generally does not play host to a very robust microbial community. The very, very end of the urinary tract, the closest couple of centimeters to the opening of the urinary tract, may have some transient colonization with microbes, but the idea is that the flushing action of urination and the acidic kind of pH of the urine should prevent most microbial growth. So when you move up into the higher areas of the urinary tract, up into the bladder, up into the kidneys, those areas should then be sterile. But again, if you've ever had to give a urine sample, they often ask you to catch it midstream because, again, that couple of centimeters might be transiently colonized. So the beginning of the stream of urine will have microbes in it, but hopefully midstream, those microbes should have been washed away. Now, if we actually talk about the genital system, again, when we talk about the genital system in the penis, the urinary tract and the genital system open up into the same opening. So basically, the urine would constantly flush out the genital tract portion of the penis. But when you have the two different openings, one for the vagina and one for the urethra, the flushing action of the urine won't do anything to the vagina. So the vagina actually plays host to its own robust microbiome. So the vagina tends to be weakly acidic, so slightly acidic, and it has a lot of carbohydrates available. So again, you have a number of different microorganisms that are going to colonize in the vagina. One common group of organisms are the lactobacillus, specifically Lactobacillus acidophilus. So this bacterium actually ferments some of the glycogen that's present, producing that weakly acidic environment. The weak acidity of the vagina is often enough to prevent some of these pathogenic or potentially pathogenic microorganisms from causing an infection. So because the vagina is always weakly acidic, or almost always weakly acidic, fecal bacterium are unlikely to be able to get in there and establish a hold. And again, if we contrast that with the urinary tract is really only weakly acidic when a patient is urinating. So if a patient isn't urinating, bacteria could be propagating their way up the urinary tract. So that's why, again, we tend to see a lot of urinary tract infections when the urethra is closer to the anus. We will talk about conditions later where we have infection. For example, sexually transmitted infections. We can also have situations of things like yeast infections. So when a patient takes broad spectrum antibiotics, if those broad spectrum antibiotics happen to wipe out the normal microbes that live in the vagina, changes the pH, changes the colonization, that can allow more harmful bacteria or even harmful fungal organisms to overgrow and cause an infection. And that would be a different type of infection from a sexually transmitted infection. So you can have a yeast infection, which is an overgrowth generally of Candida albicans, a fungus. Or you can have what's called bacterial vaginosis, which is just an overgrowth of a different type of bacterium. And these are not, again, they're not sexually transmitted infections. The last part of the body where we'll talk about the normal microbiome is the skin. So it's estimated that per square centimeter of skin, there are approximately 1 million bacteria, meaning we have about 10 to the 10th bacteria on the average adult. If you have more skin, you have more bacteria. But the skin surface does vary depending on the part of the body. So we characterize skin as being either dry, moist, or sebaceous. And depending on the type of microenvironment, you will have a different proportion of bacterial phyla. And so that's what they're trying to show you here. So for example, in sebaceous skin, where you have the oil-producing glands, you have a high level of these bacteria called propionoi bacteria. These cause acne. In moist skin, this could be like maybe under your arms, not places you're prone to getting pimples, but places you're prone to sweating. You have a higher percentage of things like Corneobacterium and Staphylococci. Sometimes these stink, which is why your armpits don't usually smell good. And then you have your dry areas of skin where different, again, groups of microorganisms may predominate. So the composition of the skin microbiome is affected by a lot of different factors. Environmental factors can come into play. If you've spent your entire life living in Central California, you know exactly what it's like when it's really, really hot and dry outside and how that affects your skin. If you've ever lived in the South, you know how different it is when it's humid. Your host factors. Unfortunately, some of us probably remember what happened to our skin when we went through puberty. The skin became oilier, you perhaps were more prone to pimples, maybe you started to develop body odor, because as those hormones changed the way you secreted oil, the way you secreted sweat, the production of body hair, that could change the skin microbiome composition. Personal hygiene plays a really important role. Do you wash yourself? How many times a day? Do you take one shower a day? Do you take 2 showers a day? Do you take a shower every other day? Do you use soap? Do you use body wash? Do you use antibacterial body wash? Do you just use water and hope for the best? All of those things can also affect your skin microbiome. Do you use lotion? Do you not use lotion? How often do you wash your clothes? All of these things can affect your skin microbiome. And of course, every microenvironment on the body has its own unique microbiome. And that's what they're trying to show you here. So organisms like Staphylococcus are going to be high wherever we see red in this person. So here we have high Staphylococcus on, it looks like the bottom of the foot, so the heel, the bottom of the foot. I'm not sure, I think they're trying to show like the arm right here. And then this Propionioium bacterium, this one that causes acne, face, right? Face, back, so these oil producing areas, but not so much on your hands and feet. Think about it. When was the last time you got pimples on your hands and feet? Probably not that often, but on your face, yeah. Okay, and then this Corneobacterium, again, kind of in where the hair is, where you would sweat on your head, where you might sweat on the bottom of your feet, kind of in the groin and in the back, and then a little bit like between your toes and maybe between your fingers. So all of these microenvironments have their own unique microbiome.